Hi, everyone. We're going to get started at about 11:02 to give everybody a chance to hop in. And see people are joining. So we'll give everybody just a second, about another minute. Good morning, everyone. We'll get started in about another minute. Give everybody a chance to hop on. Okay, good morning, everyone. Thank you for joining us today for this month's Solution Spotlight focused on member engagement and experience. I'm Julie Cates, and I'm your host for today. Before I introduce our presenters, I do want to take a moment to thank everyone who has joined us for these webinars every month. We know who you are, and we appreciate you very much joining us throughout this year. I do want to mention up front that we do plan to continue these very practical webinars in 2024. So I encourage you to let us know what you'd like to hear from us so that we can get it on our calendar. I'll mention quickly, there is a survey at the end where you can put that info in there and get that back to us, or you could talk to your rep or your broker and let us know. Okay, so with that, I'd like to introduce our three expert presenters. For Blue Cross North Carolina, we have Gabe Staub, who is the Senior Strategic Advisor who's focused on healthcare programs and market offer strategy in the employer segment. We also have Emily Brannon, who is our VP of Digital Strategy, and she is her role is to ensure that we meet or exceed member expectations when they engage with us through digital channels. And Kathleen McKinney, welcome Kathleen. She is our Manager of Digital Strategy, who is focused on Blue Connect, member online and mobile self-service tools. Okay, so before we get started, I do have a few housekeeping items. As I put in the chat, this webinar is being recorded and will be provided to all registrants after the session. We'll also provide a copy of the presentation as well. Also, feel free to use the Q&A feature, not chat, but the Q&A feature to ask questions throughout the webinar. We will review those behind the scene and answer any as they pop up, but we will leave time at the end for your questions as well. And lastly, at the end of today's webinar, as I mentioned before, we do have a post-webinar survey that will automatically pop up in your browser. So when you close out, it should automatically start. And it's very quick and easy. It's very important for us to get your feedback and let us know how we can improve these webinars in the future for you. Plus, as usual, by completing the survey, you will be automatically entered into a drawing to win a $25 Amazon gift card. So please be sure to keep a lookout for the survey at the end. It's very important. Okay, with that, I am going to jump into the agenda. First, we'll briefly set the stage with a brief overview of the products and programs and member tools available to our members. Then we'll review some of the communications we deploy to inform and engage members so that they can get the most value from these healthcare programs and their health benefits. We'll show you what we're doing to improve digital member self-service, including a brief demo, which Kathleen is going to give us, of our member portal, Blue Connect. Then we'll review a few resources available to our employer clients to help you promote these health benefits and programs in your workplace. So I'm going to start with a brief poll because I think understanding why member engagement is important is very key to our discussion today. So I'm going to bring this poll up, and it is a multiple choice question. So please place your answer in the pop-up. Hopefully y'all see it now. And I don't think our panelists can see it, but you out there should be able to see it. So employees who believe their employer cares about their health and well-being are 38% more engaged in their work, 71% less likely to report burnout, 5 times more likely to serve as an advocate for their organization, 69% less likely than all other workers to search for a new job, or is it all of the above? Okay, and I see, okay, so y'all got it all right. Obviously, it's all of the above. I think you can see the results there. So good job, didn't stump anybody, but I think, some of these stats are very telling. It's actually very good news, right? So the only caveat to that is only 24% of employees are represented in those numbers. That's right. According to a Gallup study, just 24% of workers strongly agree that their organization cares about them. And this is in large part because many employees don't even know or don't have a clear understanding about what their benefits are. And so really knowing, trying to drive that and it's something that we could do to grow that 24% and get those results that we're all looking for. So this is really what drives us at Blue Cross to improve member awareness of their health benefits and programs and to increase engagement in them so that they can get the most value from their plan, improve their health, and be happy and productive, right? So at Blue Cross, there are a myriad of benefits and programs and ways in which we inform members about these benefits and programs. So I'm going to turn it over to Gabe to kind of go through a few of those today, and then also talk about the ways that we work to engage with our members. Okay.
Thank you, Julie. That's right. There are a lot of benefits and programs that we offer at Blue Cross North Carolina. Key among them are our provider network products, our national broad PPO network, and our high-quality, high-performing provider network. And both are strengthened by our Blue Cross Blue Premier value-based program and Blue Distinction Centers of Excellence for Specialty Care. So understanding how, when to access the right provider at the right time and the best price is critical. In addition to the core health benefits and coverage for medical services, we offer a full array of healthcare programs. These are to help our members navigate the healthcare system, get the most out of it to ensure their best outcomes and cost. For example, like our nurse support program, our behavioral health programs, virtual care, utilization management programs, tobacco cessation, wellness programs and discounts, again, in a broader way of pharmacy programs to help ensure medication adherence at the lowest possible cost. So if you've attended some of our previous solution webinars, we highlighted programs such as the nurse support program, the Teledoc Marketing Hub, and some of our latest behavioral health program offerings, such as Care Navigation. If you missed any of those or just want a refresher, they were recorded for your viewing pleasure. And if you want to learn more about any of these offerings shown, please contact your account management team. So that's a lot of healthcare options, and we're not even showing all of them. So we want you to be aware of and to think about how these programs can benefit your members. How do we help your members know what's available to them and get the most from their health plan? Well, we inform and guide members based on where they are in their healthcare journey, from onboarding and ongoing use of their plan to reaching out when health events happen or are going to happen. We know you are looking to us to educate your employees on the value of their plan and guiding them to take an active role in their health. Help members to easily understand and manage their health plan, and create awareness of plan benefits, educate members on the value of staying in network and how to save costs. Our goal is to spark engagement, because an informed member is an empowered member. And when a member is empowered, they can make good health choices. So I'm going to review a couple of examples. But first, the key is this, guys. We need, and you will want members to register on Blue Connect. This is truly their gateway to their health plan benefits. And when they register, we ask them to let us know how would they like us to communicate with them. They have to opt in to receiving communications from us via email, phone calls, text, as well as mail. Their welcome letter with their ID card encourages them to register, as well as many other communications, including member resource brochures, Blue Connect flyers, posters, things like that. Registering is critical because it's how we receive their permission to pass on important information to them about their benefits and healthcare programs. Yes, there are a few additional options. So if an employer wants to know if they can provide their, okay, so for example, if we're trying to encourage members to register Blue Connect on their own, and if you have a population who, you're having trouble reaching, or they just don't know about it, or they're a new member, there are a couple of different options that we can provide you so that we can get at least member emails and at least to start to send information to your members. So I'm going to go over those options. So there are a few additional options, okay? However, unlike Blue Connect, okay, when we collect emails through these different ways we're going to tell you about, these, if a member were to go into Blue Connect on their own and update their contact preferences and provide a different email from what you may provide Blue Cross about your member, that information will always trump anything that you give us, okay? So a couple ways you can give us your employees' emails if you choose to. Again, these are optional. For groups who use the eligibility file through the file feed process, it's not required, but there is a column for you to input emails for your clients, or for your members, excuse me. If you use the employer services page to add members to your group plan, there is a box that enables email as part of the data capture. And then we have something that isn't well used, but it's an option for you as a group. It's called the Group Member Contact List. We have the capability to allow groups to provide a list of member email addresses, which we then upload into our system, which allows us to at least send out the email campaigns to your members. So how do you do this? If this is something you're interested in, you would reach out to your account management team. They provide you with the template. You provide the information to your account management team, and then the account management team submits it internally for processing. So why would you want to go this path, right? Again, if you're not satisfied with the current level of member engagement in your population, meaning you want them to get some of the campaigns such as preventative care, things like that, this is a route to consider. And again, just remember, if you do provide us an email, but your member has already gone into Blue Connect and submitted a different email, the Blue Connect email is the one that's going to take precedence over anything else.
That's great information, Gabe. I really appreciate you mentioning that, because I clearly didn't have that on this slide, but this is definitely a great way for our employer clients to help us get the information we need to be able to help inform what their benefits are. So, and what that some of the healthcare programs are that are available to them. So thank you for reviewing that.
Sure. Okay. So here are a few of the communication campaigns that we have for your group members. These are not all of them, just a list. So we have a nurse support campaign, which encourages members to take the call from a nurse when they're discharged from the hospital or have been recently diagnosed with a chronic condition such as diabetes or hypertension, or their medical bills reach over $50K. We have campaigns to encourage members to know the value of their PCP, their primary care physician, and on some plans, if they go in and they input their PCP into Blue Connect, we will waive the copays for those members for their first 3 PCP visits. We have campaigns for frequent flyers of the emergency room, showing them lower cost, more convenient alternatives like utilized telehealth, PCPs, or even urgent care. We have campaigns to inform members that they've gone out of network, and again, how to find lower costs. And one important one, in my opinion, is campaigns to inform members that they have a preventative care gap for an overdue service, such as a mammogram, a colonoscopy, or a missed diabetes A1C test. But our flagship campaign is our Know Your Plan campaign, and to help welcome and onboard members, and also to help get the most of their plan throughout the year. So we're going to highlight what that looks like. And this campaign starts with the member's effective date and continues for 4 months with information that is personalized according to their plan benefits. The purpose of the onboarding and plan management campaign is to educate employees on the value of their health plan benefits and programs, encouraging them to take an active role in their health. This campaign goes out to all eligible members, except with the following exceptions: members under 18, members who don't register for Blue Connect, members who did register for Blue Connect but have opted out through electing this through their contact preferences, those members with groups who do not opt in to receive Blue Cross communications, and members we do not have an email address for. However, in previous slides, we did mention ways for you to provide emails to us so they could get this campaign. Okay, so shown here are some examples of the communications. We have examples of emails, Blue Connect portal ads, SMS text, and web pages, but these are just the tip of the iceberg. I'm going to review some of the tactics and the timings in a bit more detail. Okay, so what is this? So this is actually our plan for the onboarding and plan management campaigns. So onboarding is what we call wave 1, and we are encouraging our members to sign up for Blue Connect, register an account, go paperless if they want to. And if they do respond, then they're good. The next wave is coming. But if they haven't, we will send a reminder email if no response, seen there, called wave 2. Then, if the member registered for Blue Connect and gave us permission to email them, then they will start to receive the next 6 waves of emails over a 3-month period of time. So wave 1 is make the most of your plan. 2, savings, how to use Blue Connect, how to find a doctor, how to find cost of care, those types of things. The next one is an email campaign about at the doctor. Then we go to pharmacy programs, behavioral health and mental health programs. And then obviously my favorite is health and wellness programs that your members have according to the benefits that you selected. Next.
Yeah, I'll just mention here real quick, Gabe, that this is the content that is available as part of this campaign, and this is the cadence. So in month one, say if this is January effective date, week 2, they'll receive email or wave 1. And then if they haven't done anything, they'll receive wave 2 here. And then starting with month 2, let's say this is February, in week 2, they'll begin to get each of the plan management waves. So that's how this timing works out. Okay.
Thank you, Julie.
Yep.
Okay, so as mentioned, again, there are 6 waves of the plan management emails that are personalized depending on the member's plan's features. So these are the first 2 waves and are only portions of actual emails. Okay, so we're showing you examples. For example, email number 1 is knowing about where to go for care, and if a member has the blue HPN, our high performance network plan, it stresses the importance of staying in network and even lists the providers in that member's area. So for example, if I live in the Charlotte area or the Triad area, it's only going to list those providers in my area. Email number 2 on the right, ways to save. If the member doesn't have a program called Smart Shopper program, they will not see Smart Shopper messaging. If they don't have the Smart Shopper program, again, they will be guided to go to Blue Connect and use our Find a Doctor tool or the Compare Cost tool to be able to see the cost differences of different services that they might be seeking.
Hey, Gabe, would it help if I just showed just a quick example of what the entire email looks like? It might be interesting.
I think it would.
And remember, we're sending out this presentation after, so I've got some links in here that I can provide. But this is actually what it's a representation of what it looks like. But you see some of the programming that's in here. But if they have Smart Shopper, again, this is what we just saw. If they don't, this is what they'll see. Mm-hmm. If they have Helpline Blue, they'll get information about Helpline Blue. And at the end of our emails, we have these ads, if you will. They're like banner ads that remind them to do certain things. And if they've already registered, then they're not going to see this register today. If they've already downloaded the app, they're not going to see this. But you'll see where we will continue to emphasize some of these, like going paperless and whatnot, if they have not done it yet. Here's the choose the PCP. If they've already selected their PCP, they won't see it, but if they haven't, they will. So, I mean, there's just, a whole lot that's on here, but I don't think at any point in time everybody will see everything because it's awfully long email. I think what's more representative is what you have here. So just wanted to point that out. There's a lot going on behind the scenes to make it really dynamic and really personalized.
Thanks, Julie. Just quickly, email 3 and email 4 are shown. So email 3 is how to prepare for visiting the doctor, getting preventative care, and other alternatives like telehealth, or who to call at Blue Cross if you have questions. Email 4 is all about how to get the most from your pharmacy benefits. But if the member does not have pharmacy benefits with us, they will not receive this wave. Email 5 and 6. 5 is dedicated to understanding benefits of behavioral health and how to get care they need. And email 6 is about wellness and all the programs that are available to improve their health. All of these emails link to deeper program information or to the plan management landing page for more information on the topic. So again, if a member clicks on something, it will take them to an additional page where they can learn more about the program. Okay, that's it for me now. So you'll hear from me in a little bit. Our next panel expert, Emily, she's our VP of Digital Strategy. And Emily is going to review how we measure your members' digital experiences. She's going to show the latest and greatest app and Blue Connect enhancements. And she's going to give us an early Christmas present by discussing future upgrades. Thank you.
Good morning. Thank you, Gabe. Appreciate you having me this morning and happy to join you all. I do want to go through some information, just sharing with you what we focus on, why we focus on these things from a digital self-service perspective, and also provide some examples of things we've done, why we did them, and kind of the measurement of that. So I'll first start with, how do we measure experience? We're going to focus a lot on the member today, but how do we measure? We measure through a number of different things. We look at what our competitors are doing. We work with our line of business partners of what do they want to offer within our digital channels. But we also look at and listen to our customer. What is our customer saying to us? And as I mentioned today, we'll focus a lot on the member, but customer in general is big C customer. It could be the provider feedback, it could be employer feedback, agent feedback, et cetera. But what we do is we look at a number of dashboards. This is just illustrative here, but a number of dashboards of what are our key performance indicators? How are they trending up and down? What are our members saying that are difficult for them to do or they couldn't find? We also have a tool called XM Discover that analyzes customer feedback through all our channels, through our phone, through chat, through voice, listens to sentiment. So we can see not just what they're saying through the digital channels, but what information are they providing us through phone calls and chat as well. So we look at this data and we determine what is causing friction, what are people asking for, where do we need to focus. So I'm going to provide a few different examples of today of direct from customer feedback and or from industry areas that we needed to focus. So the first is our Blue Connect mobile app. So in 2011, 6% of online traffic was through a mobile device. By 2021, it was 56%. I don't have an updated percentage on that, but looking at our own behaviors, when you're not at work, are you on a computer or are you using that mobile device? Most of us use a mobile device the majority of the time when we're not working. So prior to August of 2022, our Blue Connect member portal, we had a desktop or a computer version, and we had a mobile app for both Apple and Android. But we had two different code bases. We had two different development teams. We have two different strategies. So when we wanted to implement a new feature, if we wanted it on both the desktop and mobile, we had to develop that feature twice, test it 2 different times, and deploy it 2 different times. So what we did is we actually combined the code base for both our desktop and mobile apps. We don't want members to have to choose if they want to look at an EOB. We don't want to force them to a computer to do that. We want them to use their mobile device if that's how they want to access via self-service. So we unified our code base for desktop and mobile app. Prior to 2022, we focused on desktop primarily. And so what we did is we shifted to mobile first development. And this was a strategic decision for a number of reasons. Number one, as I mentioned, we want to give our members choice. We don't want to force them one place or another in order to access something. But it also enables us to develop things faster, to deploy more. And you'll find that probably 95+% of the time, we want those features to be available both on desktop and mobile. So what have the results been? You can see on the right-hand side here, for our Apple App Store ratings, we saw an increase of 14%. So I don't know if you're like me, but when I go to download an app, I look at that rating. Is it a good rating? Is it a poor rating? That's going to kind of determine if I use it or not. So from an Apple perspective, we went from 3.7 stars up to 4.2 in a year. And then from an Android perspective, we saw a 31% increase from 3.2 stars to 4.2. So I think that's really shown that change has made a difference. And now we're developing mobile first. If I go to my next example, ID card alerts. So we actually looked over a 12-month period at our call center volume. So why are people calling us? There are reasons people want to call us. There are reasons that people have to call us. And for those situations where people want to self-serve, we want to make sure that functionality is available from a self-service perspective. So we looked over a 12-month period at our call center volume, and we saw about 5% of our live service inquiries in that time frame were related to ID cards. So we established proactive alerts and notifications. I don't know if you're like me, I'd love to get a text message when I need to know something. Hey, your bill has been paid. Hey, your EOB is available, those type of things. So we established proactive alerts and notifications. This is both via email and SMS to alert members. Number one, that their ID card is now available in Blue Connect, so you can go view it, download it, etc. And number two, your ID card has been mailed. So you don't have to call us to say, hey, I haven't received my ID card. Is it on its way? I need the status, etc. So when we first launched this feature, anybody that had confirmed their email address or they had enrolled in text messaging, it's about 380,000 members were eligible to receive this alert. And you can see on the right-hand side here, we measured this probably about 6 to 8 months after launch. And we're going to have another big wave of alerts this month because a lot of ID cards drop in December. And we saw a 41% reduction in ID card related calls. So those that received the alert versus those that did not, we saw 41% reduction. Usually when you see a downward arrow, it's not green, but in this case, it was a good example. We have a number of alerts and notifications that we would like to launch in 2024, focused on claim status, accumulators, things like that. So people don't have to come search that and or call us, but we can proactively alert them when something has changed or they need to know about something. So on the topic of ID cards, this has not yet been launched, but I did want to make you aware. Digital ID cards in Blue Connect have been, or digital copy of the ID card has been available since 2017. However, digital expectations are growing. I went to a concert just a few days ago, and to put that ticket in my wallet was really nice. I didn't have to open anything, Ticketmaster, try to log in. It was right there when I needed it. Well, consumers are demanding these type of things with cards, with tickets, with airlines, etc. And quite honestly, ID cards are no different. And we're seeing that providers are beginning to accept digital versions. They might still ask for the physical version, but they're willing to accept the digital version as well. So in 2024, we'll be launching ID cards in the Apple and Google Wallet. So I just want to make sure you kind of keep your eye out on that. We'll definitely communicate that as we get a little bit closer. It's still going to be available in Blue Connect as well, but for members that just want to have that ID card in their digital wallet, they won't have to log in anywhere to access it. So the next example that I want to bring up is member PHI authorization form. And really what I want to focus on here is inbound forms. So today, we make our members and our providers fax or mail in a lot of the forms to Blue Cross North Carolina. I will tell you, I don't even have access to a fax machine. I'd have to go somewhere for that. And so we really need to keep up with demand. Excuse me. So the first form we digitized earlier this year was the member PHI auth form. If you look on the left here, this is the physical form. We still have that available. Member prints it, completes it, mails it in. Somebody gets it on our end, has to physically enter that information. So we actually digitized this form. We launched it in April of 2023. And what is really nice about this form is we had a lot of mailbacks on the previous form, missing information, couldn't read handwriting, whatever the case may be. When we digitize this form, you actually have to, a member has to log into Blue Connect. So we already know who they are. We know their member ID. We know certain information about them. So you can see in the screenshot, we have 3 easy steps with very little information that we're asking. The member can also not submit the form without it being completed. So we launched this in April of 2023, and we've seen amazing results from this form. Number one, we've seen the number of forms increase. So the percentage of submissions that have been increased in general, that have been submitted in general have increased. So if you look at that yellow line, that's 2022. We only allowed paper. 2023. And then if you look at the bar charts, that's 2023 paper and 2023 digital. So 2021 and 2022 are the lines. The bar charts are 2023 paper and 2023 digital. The very first month that we launched this, we saw over 50% digital submission. And you can see in November, we got an 80% digital submission. So number one, we're getting more forms submitted. Members can actually see that form in Blue Connect and the status. We are seeing more done digitally, and equally as important, the number of mailbacks are minimal. Minimal mailbacks, much better customer experience. So we started with this specific form first, but I do want to mention that we're focusing on inbound member claim form next, which is, I know, a huge call driver, huge member dissatisfier, a lot of mailbacks on those. And so by the digital submission, we should be able to improve on all of those things. The next example I want to share is paperless. So Gabe talked about paperless a little bit earlier. What does paperless mean? So in our case, it means that the member would receive their medical EOBs and their letters electronically. They actually receive them in Blue Connect. They go in and access them, but we send a message to say, hey, this EOB is now available. Go into Blue Connect and you can access it. The other way is to get it via paper. When we started the year, and I should have had Julie do this as a poll question because this is an interesting one, but when we started the year, we actually had about 97% physical paper delivery. We've had paperless for, I'd say, a few years. We know people want to go paperless, but number one, it's difficult to figure out how to go about electing to go paperless. We also did some email campaigns, which resulted in some adoption. But I don't know if you're like me, I get a lot of emails, don't catch all of them, don't necessarily take action. So what we did in the September timeframe is we put a prompt in front of our members post Blue Connect login. So if they were not already enrolled in paperless, when they logged in, they would get this prompt, which is that first screenshot there that Julie's circling. And it would say, do you want to switch to paperless? And it's 3 very easy steps. If they decide they want to go paperless, they enter that email address. If they've already confirmed it through prior enrollment into Blue Connect, it's an even quicker process, and they go paperless. We have seen this year, and largely within the past 2 months, 203% growth year to date. So of the people that have been prompted to go paperless, which is not everybody, because not everybody's logged in since then, we've had about 94,000 members that are now enrolled in paperless. We've seen about 20% of those prompted go through the steps to go. So very, very high adoption rate. They also have the option of saying maybe later and dismissing it. And in a few months, they could be prompted again. Some of the benefits is members actually get access to those EOBs faster. As soon as they're available to us via a digital version, we make them available to our members. So they have access to them a lot faster. They're in Blue Connect for a long period of time, easily accessible, etc. And then from a Blue Cross perspective, it's this 8.5% adoption results in over 1.1 million in OPEX savings. So that is savings to Blue Cross, but ultimately that's going to be savings to our member because that can reduce the cost. We can pass that reduction on in terms of our plan and cost of our plans, etc. So it is a result of a reduction in cost, our operating expense, but that will be a benefit to our members, to our groups, etc. So we will plan on additional tactics, working with our groups to go paperless, etc., but have done that really from a member perspective at this point. So those are just a few of the examples of things we've done in the past year. It's really important for us to look at what are members telling us? What are things that are easy for them? What are things that are difficult? What are the things that they want to do that they can't today? We look at what the members that start digitally, they are digital, but they end up having to call because they can't do something that they want to do. We want to make sure that they can stay in digital and they don't have to call. The call center is always available. We want members to call when they have questions that they want to talk to a live agent. But when they want to self-serve, we want to make sure we enable them to self-serve. So these are just a few examples of things that we've measured that we've gathered feedback on, that we've implemented, and then we've measured to see, is that a good move? Was that a good tactic? Is this something that we should enhance, or should we do something different? So what is our digital path forward? So I want to set the stage here. Current state is obviously where we are today. But our baseline is 2020. So if you look on the left side there, this is kind of where we started in 2020. I joined the organization in 2021. My background is actually digital strategy, digital channels. And I was brought into the organization by Carla Mazel, our SVP of Operations and Member Experience. When she joined the organization, she did a lot of listening to calls, listening to members, listening to employees, listening to groups. What are people saying? What do they want? What are they doing? What are they having dissatisfaction with? And what we learned is we had a lack of a unified digital strategy. We had digital channels. We implemented things in our digital channels, but we really didn't look at it from the lens of the customer. And as we all know, COVID has increased consumers' reliance on digital. If you were not a digital user pre-COVID, you became a digital user during COVID, and many have continued. And so it's really important that we as Blue Cross North Carolina make these digital assets very valuable for our end user. So we started, number one, we had this lack of unified strategy. We really didn't have a lot of key performance indicators. We didn't do a tremendous amount of listening to member feedback. We did do some, but it wasn't a huge area of focus. And so what we did was we centralized all the digital channels, and we now have a centralized, holistic digital strategy and multi-year roadmap. So we first started by implementing foundational capabilities. I went through some of those today. You know, developing mobile first, that's pretty foundational. Launching alerts and notifications. If you use digital banking at any bank that you bank at and you pay your bills online, alerts and notifications are very standard. So we would consider these very foundational capabilities, but that's where we started to meet the basic self-service demands of our customers. Many of these we've reviewed today. But where do we want to go? We want to have highly competitive and engaging digital offerings. We want to make sure we can drive greater self-service adoption, 24/7 access when you, the end user, want to. It could be 10 p.m., it could be 6 a.m., not always when we're open from a call center perspective, but we want people to be able to do it on their time. We want the experience to be highly satisfied, and ultimately, we're working towards better health outcomes. So right now, we're working on access and getting information on your claims. We're really focused on better health outcomes. We need the solutions to be personalized and proactive. And in order to remain competitive and relevant, we have to continuously optimize. Digital's not a once and done. We have to continually optimize. The demands change, the needs change, and we need to make sure we both keep up with competition, but also with what our members are demanding and expecting of us. So high-level overview of some things we've done to date. I'm going to turn it over to Kathleen McKinney, who's actually going to do a demo of Blue Connect. So you can see, if you don't use it today, what Blue Connect looks like and some of the services offered. Kathleen?
Yeah. Thank you, Emily, so much. Let me share my screen. All right. Good morning, everyone. I'm Kathleen McKinney, and I'd like to introduce to you our secure member portal, Blue Connect. This Blue Connect website and our Blue Connect mobile app, which is available in both iOS and Android devices, provides a consistent member experience, which is what Emily had mentioned. Right now, I'm showing you our login page, and from here, members are able to reset their password and/or retrieve their username. Each member on the plan can register a Blue Connect account. However, some features may only be available to the subscriber of the plan. So I'm going to log in, but I'm going to comment that this is a test environment and I'm using a test dummy customer because we don't want to share PHI information. So you might see some things are unavailable. So I'm going to log in. This is our dashboard. After a member has registered an account, those credentials can be used to log in to the Blue Connect website or the mobile apps. Members will be able to manage their Blue Cross Health, prescription, dental, or vision plans all in one place. So this test customer only has health and prescription, but if they had vision and dental, they would have their own tabs. The dashboard provides the member quick, easy access to top self-service features such as viewing claims, searching for a provider and estimating cost, viewing or ordering an ID card, checking coverage information or fund account balance, contacting customer support, selecting a primary care provider, and much more, including if they have a fund account balance that would show up on the homepage as well. If needed, members have this floating help center. It's on every page throughout the site. Here, a member can leave site feedback, which you know is important for us. They can access secure chat, and then other contact options as well, such as secure inbox. Secure inbox allows for two-way communication between a member and our service professionals, as well as provides a way for Blue Cross to send targeted one-way communications such as care gap alerts. Now we're going to move on to our coverage area. The subscriber can access coverage information as well as view and print a digital ID card. The digital ID card is an exact replica of the printed card and is easily accessible while on the go. So you can view the front, the back, print and download, and soon on your mobile app, like Emily mentioned, into your Google or Apple Wallet. Also on this page, you'll see PDF versions of plan documents such as the benefits booklet and summary of benefits and coverage, which opens up in a separate tab in a PDF version of the document. Claims is our next area we would like to review. Members can access expense summary showing members' progress towards deductible and out-of-pocket and their claim history. Using the plan selector up top, member can also view claims and expenses for any past plans for up to 18 months after the termination date. Clicking on a specific process claim will provide a detailed breakdown of that claim in a downloadable PDF version of the EOB, which is not available in our test environment. The next area is Find Care. This Find Care area includes the ability to search for in-network providers, estimate procedure cost, find the closest urgent care facilities, and review preventative care information. Subscribers can also designate a PCP for themselves and each member on the plan. Here, members can directly access and schedule telehealth services at the Teledoc portal. Now we're going to go through finding an in-network doctor. To find an in-network doctor, to find care, this includes the ability to search for in-network providers, estimate procedure cost, and to simply search for a provider by a facility or their name or a procedure. Members can filter the results by a variety of criteria using the menus up the top or by utilizing the tiles that contain the frequently used searches. So I am going to search for a medical cost. You can either search for the medical cost by typing it in the box or selecting it and browse by category. So I'm going to select this. I'm going to select a surgery, bariatric surgery as an example. Members can toggle the results via a list view or a map view. They can also see an estimated cost for their procedure and also click through to see the detailed cost breakdown based on their current deductible and out-of-pocket accumulation. Members may be prompted with a lower cost provider to consider if applicable. So for this one, there was one lower cost provider that they referred me to. Here you can see the member will have to contribute some to meet deductible before being billed at the member's coinsurance percentage. Also displayed, if applicable, is the member's fund account balance and their HSA or HRA account that can be used to pay for the member's portion of the procedure. Now we're going to go into our document library. The document library in Blue Connect provides an easy access to digital documents all in one place. Members can view their EOBs, see a copy of their ID card letter, or access member letters. And you would click on the ID card letter and it would open up in a new tab and you could download it or save it or print it. Next, we're going to go through our paperless process, which Emily showed an example of the prompt that we have in Blue Connect, but members can also go directly to enroll in paperless. So I'm going to update delivery preferences. As you can see, members can easily opt in to receiving email notifications of digital documents by visiting this section, the profile section, and signing up for paperless delivery. It's easy to sign up. You just click on the toggle and you either confirm this is your email or you need to change your email address. If a member changes their email address, they must validate their email address within 3 days to complete their paperless process, whether they change it or we're using existing. Text messaging is also available for some plan information and account alerts. Now we're going to go into our wellness page. The wellness area provides a variety of resources, including access to a Rally Health portal, information on our nurse support program, nutritional counseling, and also here members can find information about behavioral health support and sign up to receive emails from our Blue 365 member discounts provider. So I hope you can see that Blue Connect is an easy to use self-service portal to help members manage their health plan. Now I'm going to pass it over to Gabe, who's going to present the Blue Connect report and promotional resources we have for clients and brokers. Thank you.
All right, thank you much. So I'm going to go over a couple things that if you're wondering, what are ways that I can promote Blue Connect, the benefits and programs and services that we have that we talked about today, what's out there. So when it comes to reporting, this is kind of cool, actually. If you want to know what your members are utilizing on Blue Connect, we can help. We have a report called the Blue Connect Group Report, and it's available upon request. So you have to go through your account management team. The report provides things like number of visits to pages, top 10 pages people visit, top page searches, top find the care services, devices used, so mobile, computer, member demographics, and more. It's very insightful. So it can provide you direct feedback on your members' interactions and potentially provide you with your members' gaps in knowledge, services, and conditions to focus on, and honestly, how to potentially market to various demographics in your population. For our ASO groups, we have something called a Blue Connect registration report. Again, reach out to your account management team and they can provide this for you. This shows the number of registrations and also provides the date your members registered for their Blue Connect account. So after this presentation, if you start going to your members and start to use some of these materials that we have, in about 2 months or so, you can say, did our promotions work? Compare the two numbers between the 2 months, and you should see a difference. We have Blue Rewards and Wellness reports. Again, this would be for our ASO groups who either purchased the standalone Blue Reward buy-up or a la carte offering, or for groups who have purchased track 2 or track 3 of the Enhanced Rally program. It would show you the number of people who have done the Contact Preferences Center actions. Then obviously everybody knows this, I hope. Agents and employers, you guys have access to the portals where we have a ton of promotional materials such as brochures, posters, toolkits, brain shocks. Again, those are short videos with voiceovers, and you can, share those externally. They're self-guided, so if you don't want to listen to the whole thing, you can just skip through. email templates, and more stuff on there. So if you need help navigating through that, where things are, again, reach out to your account management team. And then finally, Julie just showed us, or she's showing some of the materials that are available to help promote Blue Connect, brochures, posters, those types of things, email templates. They're also available in Spanish. And then this shows you all of the Know Your Campaign and plan management campaigns. It gives you an idea of everything that we talked about today, just in a flyer, so you can help educate your members to be on the lookout and also educate yourself on what we're doing. So thank you very much for your time. I'm going to turn it back over to Julie to close us out for 2023.
Hey, Gabe, thank you. I really appreciate that. I know I kind of rushed you through those last couple of slides, but I wanted to make sure that we left a little bit of time for any unanswered questions. It looks like we do have a couple people asking about a copy of the recording. We are going to be sending that out with the deck, which has some of the links in it after the webinar within 48 hours. It takes us a while to get the recording downloaded and posted where it needs to be so you can view it. There's another question. Can brokers have access to the employer portal? Gabe, do you know the answer to that question?
So the agent and employer portals are pretty much the same thing. I'm not 100% sure if you can get access to the employer portal, but they should be the same stuff with the same information.
Yeah, I would assume they would have to be granted permission from the group administrator. We don't give them that permission. So we can follow up on that question and definitely get back to you on that. It says, is this the same info for fully insured and balance funded groups? I'm not sure what info we're referring to specifically. Can you, Sarah, can you clarify what you mean? What info are you referring to specifically? Is this
so she might be asking about some of the campaigns or what material is available on the portals.
Yeah, we do have materials, you know, for various products, programs, and whatnot for as applicable for depending on, you know, whatever funding arrangement that member might be under. So that is clarified in any of the materials that we have available. As far as the onboarding and plan management campaign, that is for all members, unless they have opted out, unless we don't have their email, that sort of thing.
It would be specific to what your plan has.
Oh, Blue Connect info and campaigns. Yes, it's for all members, Sarah. Thank you. All right. Well, to be respectful of everybody's time, I am going to close out this session. And so any further questions that you have, please reach out to us and let us know. We're happy to follow up. But anyway, I really wanted to thank all of you for joining us today, for all of you who joined us throughout the year. We've got some really great stuff planned, particularly with the webinar that we're having in January. I think Gabe has already put the registration link up there. We have our folks from Blue Cross, Mike O'Connor, who's our VP of HR, and some very dynamic speakers on his team that's going to talk about how they get their members engaged in all the various different programs available to the Blue Cross employees. So I think that'll be a fun one for sure. But again, I want to thank you all and really want to remind you that this is being recorded. We will send it out in a follow-up email. Be sure to complete the survey for the chance to win the $25 Amazon gift card. With that, I want to give another thanks to our presenters for joining us here today. I hope everyone has a great rest of the day, a great rest of their year, and have a great holiday. And we'll definitely see you next year and next month. Thank you all.
Thank you.